Welcome back. I'm so glad you're still here because this is kind of the educational part of the show. And to do that, I've got a longtime friend, John Ficker. Welcome, John.
Hi, Eileen.
We were saying last time you were on the show is when you worked at Senior Services and you were the STARS director.
Which would be sometime before 2005, so probably about 10 years ago.
Oh my gosh,
Yeah.
That's been amazing. So now you've been at various jobs, but you are now the executive director of the Washington State Residential Care Council.
The Washington State Residential Care Council. Good job.
Okay, you can say it faster than I can, but really that involves adult family homes.
Right.
And I know a lot of people have heard about adult family homes, or maybe they don't really even know what one is. So let's start out with what really is an adult family home.
Sure. So an adult family home is what they call a community residential home. So it's a residential home in neighborhoods all across the state. They provide long-term care and support services to between 2 and 6 individuals in an adult family home setting.
Okay.
So many adult family homes would serve someone who has needs with personal care, hands-on activities of daily living help. They would provide meals and laundry and all the housekeeping. Some adult family homes specialize in the care of developmentally disabled adults. And so they might have a series of younger adults who are living there who might have jobs or be out during the day. And each home, in addition to providing that care, some homes will specialize in certain types of care. So there are adult family homes that really focus on caring for people with dementia or Alzheimer's disease. And there are other homes that are owned and operated by nurses, so they might be able to do a little heavier care for people who have more medical or intensive needs in that way. And many homes also provide support for people who have mental illness. So there's a real variety of homes across the spectrum of adult family homes.
Okay, so say I was trying to find a place for my mom. She fell and broke a hip, or she was needing more care than I could give her at my home or at her home. How would you go about even finding out where adult family homes were, and then how to pick one amongst the many?
Great question. So in Thurston County and the surrounding areas, there's probably about 175 adult family homes.
That's a lot.
Yeah, and each home, because each home is independently licensed and operated, and typically it's operated by a family or a couple of people who are running the adult family home. And each owner really decides what level of care they feel they can provide safely within their adult family home. So the best way to start would be to first have a pretty clear idea about what the care needs are for the individual that's looking to move into that adult family home. And then once that's kind of been established, and that can be established, all adult family homes prior to admission will want to do or collect an assessment of the individual so that they can kind of make sure that whatever those needs are going to be able to match with what they can provide. So once that's been identified, then you can, for example, you can go to our website, which is www.wsrcc.org. And on our website, there's a locator tool, so you could go in and specify that you're looking, for example, in Thurston County or in Olympia or even by a zip code, and you'll get a return of all of the adult family homes in our community. And what we're trying to do now, we're working with the providers across the state to have them submit to us vacancies so that our locator tool will also be able to tell you whether or not that home has a vacancy.
Opening, wow, that's really cool.
And not just a vacancy, but hopefully we're going to get the level of detail that'll help somebody identify that I need an opening for a female or a male resident, and maybe get a little bit of an idea about whether they have a private room or a semi-private room, because again, each home is going to be a little bit different. But once, then you can go contact those homes, and we encourage families and we encourage providers to really look at that as an interview process to make sure that it's the right match. And we suggest a variety of questions like how long has the home been operating, Obviously, you want to bring that assessment information if you have that in terms of what kind of care needs you're going to have. Every home has a report from the state. They're all very closely monitored by the state of Washington, so you can always get a copy of the most recent inspection to make sure that, see if there's any kind of conditions or concerns that you might have about that home. One of the biggest questions that I always encourage families to ask is about food.
It's important to
it's
people.
very important. You want to make sure that the food that you're getting at that home is the right, for you culturally or for you personally. That the meal times work for you if you're a late riser. Some homes, they have breakfast between 6 and 8. For me, it's going to have to be after 10,
Yeah.
and it's just coffee. So there's a lot of things to consider, like what kind of activities does the home have? Do they have transportation services as a part of the package that they provide? And of course, the cost of the home and the funding source that you're using to pay for care.
So some homes take people that are on Medicaid, I would imagine.
Yes, they do. That's a big part of actually, we find that currently of the available homes across the state, about half of them are filled with Medicaid funded clients. And on that locator tool, it also will tell you whether or not that home has a contract to provide Medicaid.
Okay.
And when you're talking to any adult family home, they all have a policy on their Medicaid rules. So some may require a private pay period, and then you can convert to Medicaid. And other homes, you can be admitted directly on Medicaid. Yeah.
Okay. So if you're paying privately, though, what's the range? What would somebody expect to?
Obviously, that's going to depend a lot on the services and the level of care of the individual. I would say that the low end of that cost is probably between $300 and $3,500 a month. And I've seen homes, RN homes, to do very heavy care that push the upward bounds of $8,000 to $10,000 a month. But most folks probably fall into that $4,500 a month. And most of the time, I think part of the reason that we realize that Medicaid is an important way is that obviously most people don't stock away that kind of money or plan for that moment when they're going to move to an adult family home. So that's an important question to be thinking about in that early process when you're interviewing that home too, about what are your resources, what are those costs going to be. And then there are some long-term care insurance policies that will also pay for adult family home services.
Right. Okay. So your association, though, kind of brings together all the people that are doing adult family home care in the community. What brings them together? How did you get this job?
Well, the Washington State Residential Care Council was actually formed 20 years ago in 1995. And it started with just a couple of providers getting together, trying to make sure that they had educated themselves and were advocating for their businesses. And so in about 2007, they were also given what's called collective bargaining rights so that they could negotiate Medicaid rates with the state directly as an organization. And the Washington State Residential Care Council provides that service to these homes. Additionally, we provide locally, for example, we provide educational opportunities for adult family homes. Our Olympia chapter, I think our next meeting is the 30th of January. We meet out here in West Olympia at the Westwood Baptist Church, and we provide a variety of speakers that will come through. And I think, I don't know who's on this month, but I know next month, for example, we have some of the leadership from the regulatory body, Residential Care Services, and they're going to come out and do some education for providers and share some information. So those are the types of folks that we bring in to help educate and support the providers.
Excellent. So kind of a lot of things. And I know you also help with legislative issues, educating folks in the legislature that make decisions about adult family homes.
A large part of my job is really advocacy for adult family home providers. The mission of our organization is to improve the lives of those individuals that are living in adult family homes. And the way that we do that is through direct advocacy. And so we spend a lot of time trying to educate legislators about issues related to aging and long-term care. I'm sure since I'm on this show, that I can talk about the age wave, I don't have to explain what I'm talking about. But this idea that there's going to be more and more individuals coming into needing these kinds of care and services, is concerning when we look at the availability of resources and how those things are funded through our state systems like Medicaid, and how those are going to be sustainable into the future. So a lot of the work that we do up there is about educating legislators and trying to convince them to prioritize resources for aging and long-term care issues.
Yeah. So I have a question for you. Somebody's sitting at home listening to this and thinking, wow, they get $3,000 to $4,500 to take care of one little grandma or grandpa, and I could have 4 to 6 little grandmas and grandpas in my house. Oh, that sounds like a good income. I think I want to have an adult family home.
Right.
What would you say to people call you and say, this is a good idea, I want to do it?
Yeah, we definitely get those kind of calls. I think one of the things that I always like to start with is that it's not that easy to get an adult family home license. To get an adult family home license, you have to really commit to, well, first of all, you have to have a certain level of experience when you submit your application. You also have to go through a series of trainings, including an administrator training that teaches you a little bit about the care side. There's some assumption in the application that you've put in enough hours of actual care that you have some of that understanding. But in addition to that, they also try to teach you as much as they can about the business operating side of running an adult family home, which is another kind of feature that we provide as a trade association, is support for people who are often excellent caregivers and have a heart of gold and are trying to operate a business and need a little bit of support and structure in keeping those things in line. So, and when we look at the number of individuals that you're serving for that amount of money, I also like to remind people that most people can't afford. It's going to be very challenging for you to get 4, 5, 6 people in your home who can pay that type of a rate for that long of a period of time. Many folks are going to go to Medicaid, and on a Medicaid reimbursement rate, providers usually only collect at probably right around $3,000 a month. So it's a commitment to go into the industry. You really have to have the heart for it. The providers that I know that are out there that I've met locally and around the state just amaze me with the dedication and the care that they're willing to provide and the way they open their homes.
Yeah. They didn't get into it for the money. They got into it because they like people.
Yeah, if someone's looking at to get into it for the money, I would say let's double check those motivations.
Yeah.
But at the same time, I think that there's a living to be made, and you have to bear in mind that even if I opened up my home tomorrow, I'm probably going to have to hire staff so that I can go to the grocery store and maybe take an occasional Saturday off. So
Right.
Or if some of your residents need staff to be available to them overnight, then you do have to have an awake staff at night, which means you're probably paying someone to stay up all night and monitor for folks who might need assistance getting to the restroom in the middle of the night or need medication or redirection.
So what do you think are the benefits of adult family home versus, say, a larger, like, assisted living type of a situation?
Well, I think it's really important, and when we think about that kind of initial conversation, to really consider where you want to be. Most folks want to be at home, if they're going to receive care. So an adult family home is smaller and it's more home-like. I think the biggest and most obvious benefit is that there's a maximum of 6 people in an adult family home. So you're going to get a staffing ratio of 1 to 6 in the worst conditions in an adult family home. More than likely, you're going to see 2 to 6 or 2 to even 5 in many homes. So the ratio and the attention that you're able to get, I think, is much more personal. So that's a real benefit, I think, to the adult family home model. In the assisted living world, 1 to 12, 1 to 20 is probably a pretty common ratio.
Yeah.
And I'd say the other piece, too, then, is that provider knows you that well. You're in that home. For other folks, though, who might want the larger, assisted living setting with a cafeteria down the hall, you're not going to get that. You're going to get much more home-like setting, a much more quiet, maybe personalized setting in an adult family home.
Okay, well, John, it's like, I can't believe you've grown up so much. You're a real adult and you have a real job
I'm wearing
now.
a tie.
You're wearing a tie.
Yeah.
I'm just so proud of you.
Thanks, Eileen. I miss you.
I miss you too.
Yeah.
But at least we get to run into each other around the community.
Absolutely.
And that's wonderful. And
Yeah.
thanks for helping adult family homes to be all that they can be and caring for folks with all kinds of abilities and disabilities. And it's wonderful.
Well, I think I could work another 50 to 100 years and probably not feel like I'm going to make the same kind of impact on the senior community that you have, but I really do appreciate it, and I love you.
Oh, thank you. Well, we are going to be back to hear about trips and travels in just a minute, so please stay with us.